Hello everyone, in this video we are going to discuss about Staphylococcus saprophyticus. So Staphylococcus saprophyticus, it is a gram-positive cocci arranged in clusters, and it is a catalase-positive organism like all the other Staphylococcus species, and it is coagulase-negative. So we know the bacteria are divided into cocci and rods. The cocci are aerobic ones. So the cocci are divided based on the catalase test. The catalase positive one is the Staphylococcus and the catalase negative one is the Streptococcus. These Staphylococcus species are differentiated based on the coagulase test and also Novobiocin sensitivity. Coagulase positive test is given by Staphylococcus aureus, whereas coagulase negative organisms are Staphylococcus epidermidis and saprophyticus. These two are differentiated based on the Novobiocin sensitivity. Novobiocin sensitive ones are the epidermidis ones and resistant ones are the saprophyticus. So based on the flow chart, we can say the Staphylococcus, all the Staphylococcus ones are catalase positive, whereas this saprophyticus and epidermidis, these two are coagulase negative. Novobiocin resistant one is the saprophyticus, whereas epidermidis one is the Novobiocin sensitive one. It is a Urease positive organism like Staphylococcus epidermidis. It is a part of normal flora of the genitourinary tract. So the virulence factors are of these saprophyticus are adhesins. These are present in the bacteria, help to stick to the uroepithelial cells that is present in the genitourinary tract. So these are the urease positive organisms. So these produce urease. These urease enzyme, what it does, it will increase the pH of the urine so that there is no low pH. These increase in the pH of the urine will helps the bacteria to survive in the urinary tract. So these two are the virulence factors, and there are no major exotoxins which are produced by this Staphylococcus saprophyticus. So the clinical diseases which are caused by these are urinary tract infections. It is the second most common cause of urinary tract infection in young women after E. coli. The most common cause is E. coli. The symptoms will be dysuria, increase in the frequency of urination, suprapubic pain. These three are the symptoms of urinary tract infections. And on urine cultures, we can see positivity of the urine cultures. So the diagnosis can be made by staining. We can see gram-positive cocci which are arranged in clusters. On urine culture, we can see gram-positive cocci. It is coagulase-negative organism and catalase-positive organism, resistant to Novobiocin, and Urease test is positive. On blood agar, there is no hemolysis. Non-hemolytic colonies are seen, and mannitol salt agar, there is partial mannitol fermentation, unlikely to the Staphylococcus aureus, which shows complete fermentation of the mannitol. So the treatment of this Staphylococcus saprophyticus is trimethoprim and sulfamethoxazole. Alternatively, nitrofurantoin can also be given. So whenever we see a question, we should always look for coagulase negative Staphylococcus with Novobiocin resistance, and the thing is urinary tract infection in young women, normal genitourinary flora, urease positive organism, and no hemolysis on blood agar. So let us see a complete gist of all the three species of the Staphylococcus, the main species. The Staphylococcus aureus, we should always look for golden yellow colonies on nutrient agar, coagulase positive test, protein A, it is a virulence factor, rapid onset of food poisoning, toxic shock syndrome, toxin 1 which causes toxic shock syndrome, scalded skin syndrome. And we should always look for post-viral pneumonia, abscesses, osteomyelitis, endocarditis in intravenous drug users, where the tricuspid valve is the most common valve which is involved, and catalase positivity. Whereas in Staphylococcus epidermidis, we should look for coagulase negativity, biofilm formation, prosthetic valve, endocarditis, catheter and shunt infections, and these also involve the prosthetic joint infections also, the Novobiocin sensitivity and urease positivity. And common skin flora, these are the inhabitants of normal skin flora and blood culture contaminants. So the Staphylococcus saprophyticus, you should always look for coagulase negativity, UTI, that is urinary tract infection in young women, Novobiocin resistance, urease positive, genitourinary flora, which is a normal part of genitourinary flora, weak mannitol fermentation. So these are the important points in Staphylococcus, all the Staphylococcus, and these are the important points in Staphylococcus saprophyticus.